Recently, a female Jiu Jitsu athlete asked me, in my opinion, are oral contraceptives performance-enhancing medications or performance-impairing medications? And I humbly suggested to her that it depends upon the medical condition being treated, her own unique genetics, and the compound being ingested. Let me explain. Every adult female athlete who performs well and has a sense of well-being, feels well, has a unique ratio of many hormones in the body. These include estrogens, which are synthesized in the ovaries and other tissues, progesterones, which are synthesized in the ovaries and other tissues, testosterone, synthesized in the ovaries and adrenal glands, DHEA, which are synthesized in the adrenal glands, and sex hormone binding globulin, which is synthesized and released by the liver. The main anabolic load in a female athlete is carried by testosterone and DHEA. As we move up to the brain, the hypothalamus releases a hormone named gonadotropin-releasing hormone in pulses. This stimulates the anterior pituitary gland to release follicle-stimulating hormone and luteinizing hormone. These two hormones control and stimulate the production of the hormones we just mentioned, plus regulating the menstrual cycle, being responsible for ovulation, mid-period, etc. When a female athlete takes oral contraceptives, she is providing her body with doses of estrogen and progesterone exogenously from outside the body. The body senses that there is enough estrogen and progesterone circulating and thus suppresses the release of follicle-stimulating hormone and luteinizing hormone. This prevents ovulation, among other things. Oral contraceptives can be used to treat many medical conditions. Obviously, preventing ovulation, so for birth control. They can be employed to lighten heavy periods. They can be employed to make painful periods less painful. They can treat polycystic ovarian syndrome, endometriosis, shrink ovarian cysts, among other things. These can be very positive. However, many times oral contraceptives can upregulate the production and release of sex hormone binding globulin. And they can decrease the production and release of testosterone because LH levels are suppressed, and DHEA, the main anabolic substances that a woman needs to perform well. So how can oral contraceptives be performance enhancing? One common way, of course, is if we have a young athlete with heavy periods, and because of those heavy periods, she develops an iron deficiency anemia. Certainly, iron deficiency anemia is a performance impairing medical condition, so correcting that would help her performance. Or let's say she suffers from painful periods. Having to compete with cramping certainly would be a performance impairing condition. Abdominal and pelvic pain due to endometriosis or large ovarian cysts can certainly be performance impairing. Therefore, in many women who have medical conditions that can impair their performance, by smoothing out the menstrual cycle, they may be performing better after being placed on oral contraceptives. In those cases, they are performance enhancing for them. One possibility of a performance impairing situation would be, as we mentioned, in some women, depending on the formulation and her unique genetics, exogenous estrogens and progesterones can increase the synthesis and release of sex hormone binding globulin. A higher level of sex hormone binding globulin, which has a high affinity to bind testosterone in the bloodstream and render it unavailable to bind to the androgen receptor, in theory could be performance impairing because you have lower free testosterone levels. Also, obviously, we mentioned that exogenous estrogens and progesterones can decrease the endogenous, the in-the-body production of testosterone and DHEA because FSH and LH have been suppressed in the anterior pituitary as far as release. So, for example, a female athlete using oral contraceptives for certain medical conditions, including birth control, if in her unique situation, SHBG levels skyrocket and production of testosterone and DHEA is suppressed, that could be a performance impairing condition. Therefore, oral contraceptives are a perfect example of a medication that could be performance enhancing or performance impairing, depending upon a woman's unique genetics, the medical condition being treated, and the formulation.